Hello everyone, today's video is another Q&A video talking today about methylene blue in pregnancy, nasal probiotics for allergies, and, what was the last one? And fluoroquinolone toxicity. So as per usual, nothing I'm saying should be construed as medical advice. This is for informational purposes only. If you need medical advice, please talk to your healthcare provider to get that advice. And if at some point you don't mind taking a quick moment to please like, share, subscribe, and or post a quick comment on the video, I'd really appreciate it. So thanks in advance for taking a second to do that. Still working from home, hence casual wear, Dr. Raid. And here comes the video. So let's start with fluoroquinolone toxicity. So it says here, my Lyme literate medical doctor gave me Levaquin during a Lyme and co-infection treatment. Was on it for 13 days. It messed me up bad. Feel like knives in my calves and muscles all over my body are sore. He won't admit that it's from the antibiotic. How much trouble am I in now? I stopped all treatment. Yeah, so I'm really sorry to hear about that. It's just really rotten when we go on a treatment and it makes us worse and leads to persisting symptoms. I hope that I hope that that passes and that it's just a temporary thing. Again, can't speak to any specifics of folks' cases over social media, but when it comes to reacting to fluoroquinolone antibiotics, especially when there's the backdrop of Lyme and co-infection treatment, it just always begs the question, is it actually a floxing where there's a fluoroquinolone toxicity, or is it that it's a Herx reaction? And those can be really hard to distinguish between because both of them can be really awful and really very intense with the symptoms that present. So it's one of those things where I think if I had a patient who had a similar experience, then I'd be thinking if it was, say, a couple of weeks out or a few weeks out, it would really kind of depend on what the trajectory was looking like. If there was, a major flare and then the flare was kind of gradually getting better over, the ensuing days and weeks, then I'd be thinking maybe this is more of a Herx reaction. If there's a flare and then that flare is just persisting, then I'd be starting to get a little more concerned that maybe there was a floxing component. So it really kind of depends on the trajectory of things. In the event that say that scenario with one of my patients, if it seemed like it was a fluoroquinolone toxicity, then I'd be thinking about, really supporting the heck out of their mitochondria sooner versus later. Let me just see which video this was posted on. Okay, yes, this is my video called How to Discuss Fluoroquinolone Toxicity with Your Doc. So I probably didn't really get much into treatment with this one. I have posted other videos about fluoroquinolone toxicity treatment, so I won't rehash all of that here. It can be easily searched on my YouTube channel. But generally speaking, the Coles notes would be, supporting the heck out of the mitochondria, trying to work with, as much, anti-inflammatory and antioxidant support as is feasible and reasonable if tolerated, because some folks with fluoroquinolone toxicity are really sensitive to various supplements. We always have to be a bit careful, kind of phase things in gradually, and then doing what we can to try to encourage intercellular detoxification as well. Fluoroquinolones are really good at binding to certain mineral residues, so actually supplementing with minerals is one potential strategy to try to help coerce some of the dumping of those fluoroquinolones. But other things like drainage therapies and whatnot can potentially be helpful. It just really depends on the case. Intravenous ozone therapy can be one of the most helpful treatments because of the anti-inflammatory, anti-pain properties, and then also the mitochondrial enhancing properties, the detox supporting properties of ozone. But anyways, I'll leave it there for now because I think I've said everything relevant that I can think of for this. But yeah, I really hope you're doing better, and I hope it just turns out to be a whole lot of nothing and not a floxing. Next question here was on right, so I posted a video a couple of years ago called Nasal Probiotics for Chronic Sinus Issues. And then there's a question from a couple of weeks ago saying, does this work with allergies? So just for a backdrop, in the video I would have talked about using a spore form probiotic. Probably was talking about Megaspore Biotic in the video. We have a harder time getting that in Canada now, so we typically use this other product called Core Biotic from Researched Nutritionals. I'm not affiliated with either of those products. That's just what we use in practice. I find they're pretty comparable with the results. I do like Megaspore a little bit better, but it's just more cost effective and easier for us to get the Core Biotic now in Canada, so that's what we use. So yeah, it can work for allergies. I it's not really my go-to treatment for allergies. I usually use low-dose allergen therapy to try to get to the root cause of, kind of getting rid of the allergies and like just getting rid of the allergies. But the nasal probiotics can be helpful for allergies. So I have seen that work successfully for them in the past. Kind of really depends on what the backdrop is. Like if there seems to be a history of mold or like chronic sinus issues that might be related to bacterial overgrowth or yeast overgrowth, there'd probably be better outcomes using like frankincense nasal spray or silver hydrosol nasal spray, because that's actually kind of getting more at the root cause or one of the root causes of what's driving that allergy process. But the spore form probiotics can be really helpful for allergies as well. And the last one here, another methylene blue question. Just every day it seems like there's more methylene blue questions, which is great. Happy to talk about methylene blue. So this one is, when should I stop taking methylene blue before becoming pregnant? So great question. So again, just answering more generally, not giving specific advice here. So to my understanding, methylene blue is something that has not been studied in humans in pregnancy, so we have no idea what the safety profile is like. I certainly wouldn't, if I was, I wouldn't ever recommend a pregnant patient to take methylene blue. I believe that methylene blue doesn't last in the body for very long. I can't remember exactly what the half-life is, but I don't believe it's super long. But we always want to think about, what is the methylene blue doing in the body? What is it mobilizing? Is it upregulating, detox pathways? We know it upregulates antioxidant producing enzymes. Is that going to be kind of getting the detox pathways working better, which is a good thing? But if we're mobilizing more toxins, then is that going to be having any negative impact on any oocytes that are, just waiting to be released during ovulation and then, potentially participating in a successful pregnancy? So the general wisdom that I've been taught, and I haven't heard anybody say anything to the contrary that seems like better evidence supported recommendations, is if we're doing anything that has more of a notable detox component to it, so if anything that might be like flushing more toxins out of the tissues, I don't mean like, well, okay, let me start again there. So if we're doing any kind of a deeper detox, then generally the recommendation I've heard is to not try to abstain from becoming pregnant for at least a few months prior to that, just based on the way like the oocytes, the maturation rate of them and whatnot. So that's probably a pretty safe window. That's what I've always kind of gone by in practice. So what I was going to say is that if there's any more like just routine detox support, like if someone was doing some dry skin brushing, or they were, drinking like some cilantro tincture here and there, or something that's just a little more like, not like a super deep detox, if you will, then that probably doesn't need that 3-month rule per se. However, I was going to say saunas, but, and I say it depends on the case. As always, talk to your healthcare provider to get new, tailored recommendations. But if I had a patient who said, I'm generally healthy, I've been using a sauna like a couple times a week for the last, 6+ months. I don't feel, unwell when I go in the sauna. I don't feel like particularly fantastic when I get out of the sauna. I just kind of maybe feel a little bit better, but like I just do it as part of my health routine. Then I'd be thinking, that's a good idea. And it doesn't seem like there's any obvious toxin dumping happening on a macro scale, like a large scale. Because if somebody feels worse when they sauna, that would suggest they're probably dumping toxins. If they feel a lot better when they sauna, it's probably because they're dumping toxins. So if they feel just kind of like, it's just kind of a good thing, maybe feel a little bit better, then it means they're probably not really dumping anything major. So if they're using the sauna as more just of a routine detox support, then I wouldn't really view that as like, oh, you're doing a targeted detox here. We need to, we definitely don't become pregnant for a few months at least, kind of thing. So it's a little bit nuanced, I suppose. But with methylene blue, where it is pretty heavy duty, like my understanding is it's able to help with, detoxifying mitochondria from the inside out. It's helpful for, again, upregulating antioxidants and what production, which can have a big impact on detox pathways. Again, it would really depend on the dose and a whole bunch of different things, how long the person had been on it for. But if I had any sense that it was working on a deeper detox level, I would definitely recommend at least 3 months of not abstaining from becoming pregnant if it was one of my patients. I'm going to leave it there. If any other questions or comments on any of these topics or anything else, just post in the comment section below, and I'll do my best to answer as soon as I can.